90. Right. So you see, anytime you measure your blood pressure, you see some figures. There's one at the top and then the one down. The one at the top is called the systolic pressure, and it should not exceed 140. And then the lower one is the diastolic pressure, which should not exceed 90. So any blood pressure reading above 140/90 is considered high blood pressure.
Something relating to our health. Remember that saying, your health is your wealth. And today we are looking at everything to do with high blood pressure. And to join me, talk about this topic that affects millions of people without any obvious signs is Dr. Emefah Addo-Klah. Dr. Emefah has been a general practitioner for the past 8 years, an incredible professional whom my family have personally gained that support from her practice. She's phenomenal. And if there is anyone to talk about this essential topic, I think we've got the right person at B3 Inspire. Welcome to B3 Inspire, Dr. Emefah.
Thanks, Betty, and it's a pleasure to be here to have this all-important conversation with you. Thank you so much.
Fantastic. Right, let's start with the basics. So, we talk about high blood pressure or we talk about hypertension. What exactly is it?
Right. So we don't bore people too much with the medical jargons. Just
I think that's great.
Layman's
language.
So,
that's what I need.
Yeah. So we talk about blood and we talk about pressure. So we all know what blood is, the fluid that flows through our vessels.
Yes.
And blood pressure is simply the force of the blood against the walls of your vessels, particularly what we call the arteries. You know, there are two main types of blood vessels in the body. You have the veins and then the arteries. So it's the measure of the force of the blood pumping against those vessels. And the heart primarily pumps the blood and then it goes through the vessels, right? So normal blood pressure is usually around 120, 180.
Okay.
So when we say high blood pressure, which people will usually refer to as hypertension, so hypertension, or simply put high blood pressure, is when your blood pressure goes above 140/90. Right. So you see, anytime you measure your blood pressure, you see some figures. There's one at the top and then the one down. The one at the top is called the systolic pressure, and it should not exceed 140. And then the lower one is the diastolic pressure, which should not exceed 90. So any blood pressure reading above 140/90 is considered high blood pressure.
Wow, that is very informative. That's literally pressure on the system.
Yeah. And so what it basically also means is that, you know, because the whole circulatory system is about the heart and then the vessels. So what that simply means is that your heart is working harder just to pump blood around the body. So when that is consistent, the pressure in the vessels is consistently high, then you'll be declared hypertensive.
And I think there's something that you mentioned about the fact that people who have this do not necessarily feel unwell.
Exactly. So that's why basically we call it the silent killer, because people want to feel something to know they have high blood pressure, but most of the time it comes without any symptoms. So we call it the silent killer.
How scary is that?
Very scary.
But let's talk about who is at risk. Is it just older adults?
So not necessarily, because hey, now the statistics are showing that even people in their 20s and in their 30s are developing what you call a high blood pressure. In the past, you would have people in the middle ages and then the elderly developing high blood. But you know, now life and all its pressures, work, stress. So you have people in all age ranges developing high blood pressure. People in my practice, I've seen people in their 20s, people in their 30s already on antihypertensive because of the stresses of life.
20 years
and 36 years.
That's worrisome.
Yes, worrisome.
Wow. So what should be the symptoms?
Right. So like I said, most of the time it's symptomless. So if you want to wait for a symptom before you take action, you may be ending up with serious conditions like heart attacks or strokes, because for some people it just happens suddenly. So heart attacks or strokes or even kidney damage. That's the worrying part. That's why we call it the silent killer. But for people who have symptoms which definitely will end up in the hospital, it's as basic as a headache. So that headache you keep having and you keep ignoring, it may be your body's way of telling you that, hey, your pressure is high. Some people may end up with blurred vision or dizziness. Then for some people, you know, they have occasional chest pain and it's like they're just wondering what is happening. People tell you it feels like their heart is about to jump out of their chest.
Wow.
And so essentially you have the headaches, constant either frontal headaches or occipital headaches, which is at the back of your head. Some people feel some tension or strain on their necks because it's like the pressure is so high that, and then the chest pain, and then for some people, in some occasions, they have abdominal pain and all that. But very frequently, it starts with symptoms as basic as just a headache.
Okay, so if there are no symptoms, what should we be doing? Or if someone is thinking, oh gosh, what should I do? How do I know whether I have high blood pressure or not?
Right, so that's what we always say. Checkups are very important. Now it's very easy to get monitors at home because you work so hard, you're under so much stress. From time to time, it'll just be good to just check your blood pressure because we find ourselves in an age category where, because of work, because of stress, we are not eating well, we are not sleeping or resting well. People are indulging in alcoholism, so people drink excessively. People are smoking. People are not, eating right. So when we talk about the diet, they are consuming too much of high sodium diet. That is the salt, which predisposes you to getting high blood pressure. People are smoking. It's all part of the lifestyle. So it's basically a lifestyle disease, and all these things pose a risk. So stress, which is not managed well, not resting, not eating right, eating high sodium diets or intake of high levels of salt, and then not resting. Right. The risk factors, then it means basically it comes with lifestyle changes. So what does lifestyle change then entail? So something as simple as exercise, hits the gym. I mean, if you feel your lifestyle is so complicated and you cannot make it to the gym, it's as simple as taking a 30-minute walk a day, skipping, dancing, dance at home, play music and then dance and sweat everything out. So lifestyle changes, physical activity is very, very important. And when it comes to the diet as well, including more vegetables and then fruits in your diet. Fruits and vegetables have a lot of antioxidants that help us. We constantly have our cells damaging and then rebuilding. So fruits and vegetables help us a lot. Something as simple as replacing everyday fizzy drinks with water. Instead of doing your fizzy drink all the time, you can just do water.
Yes, do water.
Thank you. Water is life.
It is life.
And then if you take alcohol excessively, you may want to cut down on alcohol intake because excessive alcohol intake is a risk factor. And gradually put a stop to it. If you smoke, you may want to cut out smoking. I know it's very difficult sometimes, but you can talk to your doctor, you can see a therapist, you can go to a rehab and then gradually be helped out of it. And then rest, good sleep. Please prioritize your sleep. You can work as hard as you want, but then when it's your break time, when it's your sleep time, please do not compromise, because stresses of life is like a never-ending cycle. If you don't make time to have a good rest, or you don't make time to have a good sleep, you may be ending up with hypertension or high blood pressure. So you see, it shouldn't be about perfection.
No.
Small everyday progress over perfection.
I love that.
A little activity at a time, a little lifestyle change here and there will go a long way to help you.
That's excellent. Start small. Progress over perfection. Medication. Some people are nervous about starting it. What's your take on that?
Understandably, Betty. However, if lifestyle changes fail, medications are very essential. It doesn't necessarily mean you failed at managing your lifestyle, but it just means you're taking control, because it's a never-ending cycle. You'll be stressed anyway, and so if it's not like you've made $1 million and you're retiring and resting the whole time, living a soft life.
Even that comes with its stress as well. Too many choices.
You know, there are so many medications with minimal side effects. Of course,
yes.
You know, research goes into bringing out all these medications. And I always say, you do not talk to your friends, or you do not talk to somebody, because medications and their side effects are idiosyncratic. What may be good for you may not be good for another person. And so if you're started on an antihypertensive medication and it doesn't work for you, I think you should talk to your doctor. However, you thinking, oh, you feel fine, you don't necessarily need to take medication. See, you always feel fine until you get a stroke or a heart attack.
That's scary.
Yeah, that's scary.
Wow. Okay, so what about monitoring? How do you monitor this?
Right. Apart from going to your doctor's office and getting checked, home monitors are brilliant. Okay, it's as basic as getting to the pharmacy and getting your personal monitor. You personalize your lifestyle. So get a personalized monitor. You can have it at home and you can check it at any time of the day. You can do it in the mornings, you can do it in the afternoon, so you can do it in the evening. So I encourage home monitors, because
creating traditional and modern wisdom in dealing with high blood pressure.
Right. So I always tell people, faith, tradition, and modern medicine can work hand in hand. You don't focus on one, because you know this part of our world that we come from, we are highly spiritual people, and so you don't neglect the other and then focus on just one. So to make it all encompassing, I tell people all the time that faith, tradition, and then modern medicine can work hand in hand. You know, because of some cultural beliefs, people rely solely on herbal medicine as remedies without medical guidance as a way of managing hypertension, and sometimes that could be very dangerous, because you don't know what's getting into their system. For the herbs, some people prepare it under non-hygienic conditions, put all sorts of concoctions together and then hand it over to you as
not being
the
tested,
sole
it's not being
remedy.
researched.
Right. I always tell people that it's not as though doctors are solely against herbal medication, but it's because most of these herbs are not tested. Most of these herbs are not tested. You should be interested in what is going inside of you. And so someone can just sit in their backyard and then just put together some herbs and bring it to you. You know, sometimes it's even about the concentration. It's too strong for your kidney or your liver to handle. And then you end up with all sorts of complications. And so it all boils down to the cultural beliefs. You know, about using herbs solely for managing high blood pressure without any medical guidance. That is where the danger is.
That's very insightful. Right. And I like the fact that you are emphasizing on this, because of course we are doing this recording in Ghana, and like you rightly mentioned, there are a good number of the population that probably depends on this herbal medication, but it's about seeking that medical advice whilst using that. Before we wrap up, Dr. Joyce, what is the one thing that you wish everyone understood about high blood pressure?
So the one thing I want everyone to know is high blood pressure is preventable and is manageable should you develop hypertension at any point in your life. So it's about taking control of your life. It's about eating healthy. It's about hitting the road, exercising. It's about reducing your intake of sodium or salt.
That's right.
It's about reducing or cutting down your intake of alcohol. It's about reducing or absolutely abstaining from smoking. And so it's preventable if you change your lifestyle, and even if you end up getting high blood pressure, it's manageable. So if for anything at all you did not understand anything in our conversation, just note that high blood pressure or hypertension, as we call it medically, is preventable and is manageable.
That's excellent.
It's not
and very reassuring to know that actually you can prevent it with a small, lifestyle changes. And if you've already been diagnosed, you can actually manage it as well.
Exactly.
Excellent. Thank you for joining us. And we are looking forward to the next episode, which we are talking all about the gaps.
Thank you, Betty.
I want to know more about this, and I'm sure you want to know more about this. Thank you for joining us today on our discussion all about health. If you have not already subscribed to this channel, we want to encourage you to subscribe, like it, share it with someone who needs to hear this, somebody who probably will benefit from hearing these practical steps or tips into managing high blood pressure. And until next time, remember, build your foundation, believe in your potential, and become unstoppable. See you soon.